Good morning, okay, on 8:34. Happy Tuesday to you. Always enjoy when we have a chance to talk about kids because kids, they matter. I got a couple of kids myself, and so definitely in just that season of life. Maybe you've been through the season of life of having the young kids through the house. Some people are entering that right now. Some people have many, many years of wisdom. Somebody who does, Dr. Nadra, Lakeshore Pediatric Center, located in Denver, North Carolina. Dr. Nadra, good morning to you.
Good morning to you.
We've hung out a few times, sir, and I think this is the first time you've been in your scrubs. This is a little early for the scrubs this morning. What's going on?
Well, normally we've done these on a Friday, and Fridays are my my administrative days. But usually in the clinic, I'll be in scrubs. Every now and then, I'll have quote unquote civilian clothing. But yeah, this is more the norm.
Dr. Nadra, for those that don't know, Lakeshore Pediatric Center, lakeshorepediatric.com. What are those services, pediatric services? What does that actually mean that you provide to families?
Absolutely. So pediatrics is a subspecialty in medicine. And what we do is we take care of kids right after they're born all the way through 21 years of age. Actually, to be exact, 21 and 364 days. Once they turn 22, they go to a family practitioner or an internist. We do everything for the kids. The main thing is preventive care. It's very important to make sure that our kids are healthy so that they grow up to be healthy adults. And so we also do prenatal care. So if someone is looking for a physician or a practice that they would want to bring their baby or their child to, they can always come in and interview us and check us out, see what we do. We provide child checks. We provide ADHD and behavioral consults. We also take care of course, making sure that your kids are vaccinated appropriately, depending on the season and also depending on their age. And we, of course, take care of your child when they are sick. We have physicians that are associated with our practice that take care of them when they are in the hospital, and we check on them also while they're there. So I think that's what it is in a nutshell.
You mentioned preventative care, and it is that change of season, right? Tomorrow is October 1st. I would imagine that.
We've already, even my daughter who's in college has already had the sniffles, the cold, the back to school kind of, sickness. Yeah. Are you seeing a lot of that right now?
Absolutely. Well, the thing is during the summertime, we're all exposed to our own germs, so to speak. But once you go back to school, there's your germs interact with other kids, with other people's germs. And not to be funny, but little kids especially almost lick each other, so to speak. So they get stuff that they take back and forth. And then, of course, the winter season or the fall-winter season brings with it allergies right now. And then viruses. We actually have seen a resurgence of some COVID. We're seeing some kids or patients that are coming in with COVID, but also strep throat, not flu yet, but this is also the beginning of RSV season. So we're trying to brace ourselves in terms of what the winter is going to be bringing in with.
Asthma and those types of breathing style situations, I guess that's the best way, non-medically, I can describe it, Doc.
Absolutely.
Is that one of the more common scenarios that you see in our area? Because I'm sure it does vary, if I had to guess, population to population, area to area, as well as what different areas you're seeing.
Yeah, well, absolutely. And I don't mean to cut you off, but yeah, absolutely. In North Carolina, we're very unique in that you can have the four seasons all in one day. And so things always change, but especially now. And you mentioned asthma, and for kids or people with asthma, October through March or October through April is a very critical time because that's when there's a season change and there's changes in pressure. But even just within the same day, it could be raining one day and then the next day it's dry. And so you have a lot of pollutants in the air, but also a lot of plant pollens that are all over the place. And I can almost predict when my kids, not my personal kid, but my kids and my patients are going to come in with an asthma exacerbation. And this weather right now, these cyclones or whatever you want to call them that are coming through, always herald more asthmatics and actually herald the respiratory syncytial virus, otherwise known as the RSV virus.
That's interesting that the weather playing
yeah,
a
the
factor
weather
on
playing a
it.
part in it too. Yeah.
Is it that you're born just with allergies and you either have them or you don't, or can you develop allergies? Like, can my 4-year-old this year be 5 next year and she get allergies? Is that possible? Do you see that ever with kids?
Yeah, absolutely, it's possible. Your immune system is not, quote unquote, fully grown until you're about 6 or 7 years of age. And so it's constantly being bombarded with what we would call antigens or foreign, let's look at it like a foreign invasion, so to speak. So depending on how much your immune system is pummeled or it can actually take, you may or may not develop asthma long-term or what have you. But which is why, I mean, not to go to something different, but it's really important, which is why, it's really important for kids to get their immunizations that they need to get to protect them before age 6 or age 7, because it's a lot easier to teach a puppy new tricks versus an old dog new tricks. And things can change. You could be perfectly fine and then get something like an RSV infection or some sort of infection that knocks you down. And then all of a sudden you're allergic to this, that, or the other. Or you could be or you could have all these things happen at an early age. Like we have kids that are months old that end up with asthma, but then, quote unquote, they're magically cured by the time they're 6 or 7 years of age.
Dr. Nadra, if I'm honest, a lot of the times when we would take our then infants and even toddlers at the time, right, to the doctor, a lot of it really just had to do with the emotional side of being parents and like just not panicking and, jumping off a bridge or anything like that. What's that like as far as relationship goes, right, with patients and the way you like to do it, your practice and your staff, and how does that go for folks when they walk in? What's your expectation of that relationship?
Well, I think we all need to be on the same page, whether it's the parents or the physician or PA or nurse practitioner that's taking care of them. This is why we encourage people to come in and meet with us beforehand, because I think, there are some people that you get to meet, whether you're the patient or the physician, that you may have an instant like or dislike to. Of course, if it's a like, then hey, half the battle is won. But I always tell parents, we're on the same side. I am not trying to do something, whether it's medicine or vaccines or advice or what have you. I'm always on their side. We always have to work together as a team to make sure that our children are happy and healthy. I also tell them that once a child becomes a patient of ours, they're part of my family, meaning I will look out for them just like I look for my kids, Nahi, Edward, or Nicholas, my children. They're just like them. And I would not want to recommend anything to their kids that I wouldn't recommend to my own kids. And some people come with preconceived notions about medication, about vaccines, about homeopathic things or allopathic or chiropractic or what have you. And I like to have discussions with people so that I know where they're coming from and try to give them the reassurance that we're going to do the best that we can with the science that we have and the information that's provided to us.
Dr. Nadra of Lakeshore Pediatric Center, located in Denver, North Carolina, lakeshorepediatric.com. Doc, we so appreciate your time today. Thank you for sharing with us. We are in that that transition of season right now. So are you expecting that to be the hot topic over the next couple of months for everybody?
Absolutely. And please tell everyone that we are also available for after hours on Mondays and Wednesdays until 6 p.m. on Wednesdays till 7 p.m. on Mondays. And we now also during the season, during the school season from August through May, we have Saturday hours from 9 a.m. to 1 p.m. for any and all of our sick patients.
Dr. Nadra, Lakeshore Pediatric Center. You want a physician and a team that cares, and Dr. Nadra and his team absolutely do. Lakeshore Pediatric Center, lakeshorepediatric.com. Thanks, Doc.
Thank you. Have a great day.
You too.
Okay.